There are concerns that new, highly contagious variants of COVID-19 could push Canada into an even more dangerous third wave. Some health experts say more aggressive steps need to be taken, and the clock is ticking. Katherine Ward reports.
We've got a chance in Canada because it hasn't arrived in huge numbers here yet, but the window's closing.
Even though thousands of tests for COVID-19 happen every day in Canada, that is not the case for the new variant, commonly referred to as B.1.1.7 or the UK variant.
We look at about 3 to 5% of cases, but we're going to miss at the moment 95 to 97% of these variants when they appear in Canada.
A second sequencing test is needed to confirm if a COVID-19 case is the B.1.1.7 variant. At the moment, that is only being done when it is highly suspected. This was the case at the long-term care home in Barrie, Ontario, just north of Toronto, where officials say nearly all residents and staff have tested positive.
We've had a preliminary test showing a mutation that was consistent with one of the variants of concern. Now we know that the variant in this question is the UK variant.
And on Sunday, another case of the UK variant with connections to a long-term care home was confirmed in Bradford. Officials say countries that do the additional sequencing will have a clearer picture of what they're dealing with when it comes to the spread of the virus and be in a better position to get the pandemic under control.
There's much more sequencing going on in England. That's really why we discovered this variant. And other countries like Denmark announced this week they're going to now sequence every positive case.
Experts warn if more is not done, this highly transmissible form of the virus could quickly get out of control.
As this gets into places where there's vulnerability, there's going to be a significant amount of spread. And yeah, there's going to be hospitalizations and unfortunately deaths.
You know, those variants can grow exponentially in a background, even where cases are decreasing. And that's a real concern because those variants could overtake and lead to a much more devastating third wave.
Katherine Ward, Global News, Toronto.